honourable friend, the member for Pudsley, did not undertake to go round to see the Prime Minister and tell him what my honourable friend wanted him to say. I think he probably, had he answered the question in greater length, but he was under pressure of time, would have said that he was going to go around to Downing Street, tell the Prime Minister what a wonderful job he's doing and how lucky we are to have such inspired leadership, which I hope my honourable friend would concur with. However, I can assure him there will be a debate. There is a debate scheduled on the continuation of the Coronavirus Act 2020 provisions on Wednesday the 30th of September, and that will be the opportunity for these points to be raised.
Kevin Bratton.
Mr. Speaker, parents held vigils around the UK yesterday, including my constituent Rachel Rankmore, whose son Bailey Williams has very severe epilepsy, and they were holding those vigils because they're still paying thousands of pounds in private prescriptions to get hold of medical cannabis. Now, in Northern Ireland, apparently the administration is helping financially. Can we have a debate about why that's not happening in the rest of the UK?
Mr. Speaker, there is always a great sadness in children who are suffering from these very difficult conditions, and questions as to what drugs are made available and who pays for them. Obviously, there is a responsibility from NICE to investigate that, but I'll happily pass his comments on to the Secretary of State.
Thank you, Mr. Speaker, and my right honourable friend will not be surprised to hear that the incompetently run Lib Dem Council in Sutton is once again not listening to Carshalton and Wallington residents, this time in relation to road schemes which are causing traffic chaos across the borough. So I wonder if we can have a debate in this place about these road schemes and about the way that council should be consulting with residents properly.
Mr. Speaker, my honourable friend's right. The Lib Dems hate the motorist, of course, and want to make life as difficult as possible for motorists whenever they can. And the Emergency Active Travel Fund on the 9th of May was £225 million of funding in 2 tranches for local authorities. But the local authorities have the responsibility for how that money is spent. But the government will ensure that if they don't demonstrate that the money spent is providing improvements, the funding will be withheld.
Thank you, Mr. Speaker. It is estimated that around 320,000 private renters have fallen into rent arrears during this pandemic. Many have lost work, fallen through gaps in support, or struggled on reduced earnings on furlough. On Sunday, the evictions ban ends, putting hundreds of thousands at risk of eviction and tens of thousands at risk of homelessness. So for private renters in Coventry South and across the country, will the Leader of the House give government time to urgently discuss measures to stop this crisis, such as extending the evictions ban for at least a year, scrapping no-fault evictions as promised in the Tory manifesto, and cancelling rent arrears?
Mr. Speaker, nearly £1 billion of support has been provided for renters, increasing the generosity of housing benefit and universal credit, so that the local housing allowance covers at least 30% of market rents in local areas. Measures ensuring no tenant has been forced out do indeed come to an end on the 20th of September, but landlords have not been able to evict for the last 6 months, and there is a balance to be struck between landlords and tenants, and the government has, as I say, spent a great deal of taxpayers' money trying to support tenants.
Thank you, Mr. Speaker. Earlier this summer, I spent time campaigning to get my constituency in Erdby and Wigston out of our local lockdown, and nobody wants to go back into those kind of measures. But unfortunately, the number of coronavirus cases, particularly in Erdby, has gone dramatically up. I've told the Health Secretary that any new measures must be extremely well targeted and proportionate so that they don't affect people's businesses and livelihoods. But can we have a debate on how we best handle local restrictive measures?
Mr. Speaker, my honourable friend raised a very important point. It is important that restrictions are precise and aimed at the areas most at risk. Local outbreaks do require local action and may be a feature of our lives for some time to come, but the government's aim is to enable as many people as possible to live their lives as close to normal as possible. And he will have the opportunity, I hope, depending on the call list, to quiz the Secretary of State for Health in a moment.
Let's head to Lewisham with Vicky Foxcroft. Vicky Foxcroft.
Thank you, Mr. Speaker. On July the 16th, the Youth Violence Commission, which I chair, launched its final report and recommendations. I sent a copy to all members and peers the following week. Will the Leader of the House ensure that the Prime Minister has read the report? And will he grant us a debate on youth violence so that we can discuss these urgent recommendations and hear the Prime Minister's response?
Mr. Speaker, obviously youth violence is a very important point, and I congratulate the Honourable Lady on bringing it to the attention of the House and for the work that she has done. I think it's very suitable for a backbench business debate. I imagine it would have considerable support across the House for that. I think it would be bold of me to tell the Prime Minister what he ought to read, but I will certainly ensure that the copy that she sent to him has arrived.
We now go over to Crawley with Henry Smith.
Mr. Speaker, thank you very much. For over half a century and throughout all parts of the United Kingdom, our historic counties have been divided, merged, replaced and abolished, as my right honourable friend, the Leader of the House, will know only too well with his beloved Somerset. Can we have a statement, please, from the Cabinet Office on respecting our traditional counties, perhaps via the Lord Lieutenancies?
Mr. Speaker, the Lieutenancies Act of 1997 does set out that the ceremonial counties will be the historic counties, and it was a rather splendid act because it reunited Somerset and other historic counties which had been boulderised by Ted Heath's administration. I think the historic counties are a very important element of British history, which support the identity and cultures of many of our local communities, giving people a sense of belonging, pride and community spirit. And I hope that the counties will be recognised, though as I am addressing an honourable friend from Sussex, it's worth reminding him that the conversion of Sussex to Christianity was delayed because the woodland was so thick that it was hard for the converters to get through. But I am glad that he stands up for his county.
Marvellous. Can we just speed up because I'm worried we're not going to get everybody in. Patrick Grady.
Thank you, Mr. Speaker. I don't know how familiar the Leader of the House is with the concept of no recourse to public funds, but it means that one of my constituents has been left close to destitution while caring for her grandchildren after their mother died of cancer because she can't get her status sorted with the Home Office. Can he arrange for a minister to look into this specific case, and can we have a debate on the wider issue so that a minister can come to the dispatch box and explain how this government continues to justify its inhumane, hostile environment immigration policy?
Mr. Speaker, the honourable gentleman is absolutely right to raise a constituency issue of this kind on the floor of the House, and I will certainly take it up with the Home Office and ensure that he gets an answer.
26 withdrawn, so good to Judith Cummins.
Thank you, Mr. Speaker. I welcome the sentencing white paper that the Justice Secretary introduced yesterday, as it restates the government's commitment to increase the maximum sentence for causing death by dangerous driving to life imprisonment. But it is now nearly 3 years since the government first announced this change. Families waiting for justice have waited long enough. So can the Leader of the House tell us exactly when this legislation will be introduced to give bereaved families the justice they deserve?
Mr. Speaker, may I thank the Honourable Lady for the campaigning she's done on this very important issue and her success in developing policy on this in this area, because I think it is her influence, her questioning, that has helped the government come to its policy decision, which you will have known the Lord Chancellor announced yesterday. As regards the precise timing of the bill, I can't give an absolute answer as to the day it will take place, but the White Paper sets out a serious government priority which will be introduced as soon as parliamentary time allows, and the bill has itself been written. That is the not too distant future. So I hope that answer is at least encouraging.
Pauline Latham.
Mr. Speaker, given that the Prime Minister yesterday refused to rule out changes to the 2002 International Development Act, could we have a debate in this chamber about the implications of that for international development assistance for the poorest people in the world, and who in this House will actually be scrutinising what is happening?
Good question.
Mr. Speaker, the House decides how to set up its own scrutiny, and select committees are a matter for the House, and the scrutiny will continue as it currently is, I believe, until the end of the year, and then the House will have to come to a decision.
Thank you, Mr. Speaker. Mr. Speaker, tomorrow I will be announcing my Angel Awards, recognising the people, organisations, businesses and public bodies that have done so much to support our communities across Blaydon in the coronavirus pandemic. So will the Leader of the House now join me in thanking all of those people who have done so much, and will the government bring forward a scheme to recognise those people across the country who have gone above and beyond to support their communities?
Well, first of all, can I thank the Honourable Lady for her absolutely marvellous initiative. I think it is so important that we thank people and recognise the incredible outpouring of community spirit that there has been during a very difficult time. She's doing absolutely the right thing, and it seems to me that if the government can piggyback on the work that she has been doing, that is not a foolish thing to do. So I will certainly bring it to the attention of other ministers.
30 withdrawn. Jeff Smith.
Thank you. Mr. Speaker, every year in England, over 100,000 people in problem debt attempt to take their own lives. Now, we know it's complex and there are a range of factors that lead to somebody who's in debt becoming suicidal. But research shows that one key factor is the intimidating letters they receive from lenders. And it's a real concern with millions more people facing debt as a result of the crisis. So will the Leader of the House encourage the Chancellor to make a statement outlining how we make provisions for a small change to the rules contained in the Consumer Credit Act on the content of debt letters in order to simplify the language and signpost people to advice? I understand it can be done quite simply by statutory instrument and it could save lives.
The Honourable Gentleman raises an important point that should concern the whole House. There is a great deal of support available from organisations across the country for people who are in debt that they cannot afford to repay, and the ability of debt counsellors to help debt be rescheduled and to help lift the burden from people is there. I agree with the Honourable Gentleman. It would be very helpful if this were more widely known, and I know that all of us as constituency MPs do sometimes point our constituents in this direction. I understand the point he's making about changing the wording. Letters sent out by debt collectors ought not to be threatening. That is quite clear, and I understand his point, and I'll pass it on to the Chancellor.
Fiona Davison.
Thank you, Mr. Speaker. I was delighted to see the government launch a task force to reopen Hammersmith Bridge here in London, the closure of which has been a congestion nightmare for hard-working Londoners. But as part of the levelling up agenda, which is at the heart of this government, we need to bridge the gap between London and some of our left-behind communities. So on that note, will my right honourable friend ensure me that the government displays the same strength up north in reopening the Walton Bridge in my constituency, which has cut off communities and has been closed now for over a year?
Mr. Speaker, I understand the Walton Bridge was built in 1831, so a year before the Great Reform Bill. No, I wasn't here at the time, and it is a fine example of 19th century engineering. And the Right Honourable Lady says I'm a fine example of 19th century engineering. I'm not quite sure that's entirely true, but I'll take it as a compliment. But this is the responsibility of Durham County Council, and they ought to listen to my honourable friend. Bridges connect communities and ought to be repaired.
Thank you, Mr. Speaker. Scotland is a dynamic, forward-looking nation and is ambitious to retake its position on the world stage and do so by adherence to the international rules-based order, and when it makes an agreement with a future ally, it will stick to it. Contrast that with the way that this government is behaving this week with the UK Internal Market Bill and its ambitions to break international law. Will the leader agree with me that the Scottish Government would be perfectly within its rights to, in seeking a Section 30 order in preparation for our upcoming referendum, should one not be forthcoming, we'll just decide to carry on regardless?
Mr. Speaker, there is an incongruity in the Honourable Gentleman's comment. He says, quite rightly, that Scotland is a forward-looking, fine, upstanding nation. But then he wants to kowtow to the European Union and take Scotland's fish and give them all away to the fisher folk of the European Union. So he can't have it both ways. Either he maintains his pride in Scotland, shared with the whole of the United Kingdom, or else he wants to go and be a vassal of the European Union.
Dean Russell.
Mr. Speaker, in my constituency in Watford, we have a local landmark which is on a road called Woodmere Avenue, but it's all for the wrong reasons. As cars navigate through it, they get scratched, and residents feel like they're between a rock and a hard place, or between a post and a scratched car. in the sense that local bureaucracy and back and forth over many years has meant that local residents have not been able to get this changed. Can we please have a debate to look at how we can unwrap local issues around bureaucracy so we don't keep going through a Groundhog Day of residents requesting change, having to do petitions, try and get change, and then it not happening? Can we please get pavement politics back into government? Thank you.
Mr. Speaker, my honourable friend's absolutely right, and we really need to discourage councils from their war against the motorist. We should be backing the motorist. Driving is a great sign of one's independence, liberty, and an exercise of historic freedoms. But local authorities are quite rightly independent, so the answer is campaign to get in a Conservative council.
The Court of Appeal ruled that the government's periodic assessment regulations for universal credit are illegal, and the next day the Minister for Welfare Delivery said that they will now begin the process of carefully considering possible solutions. But 3 months and several written questions and an EDM later, there has been no update. Now, Mr. Speaker, tens of thousands of people are affected by this, and one of my constituents has continually had her passported benefits wrongly taken away because of this problem, devastating at any time, but especially during COVID. So will the Leader of the House therefore speak to the Minister for Welfare Delivery and encourage him to come before this House and provide a meaningful update on the government's plans?
Mr. Speaker, when court cases don't go the government's way, it is obviously right that things are considered very carefully. But it is worth saying that there has been a £9 billion worth of support for the universal credit following the coronavirus crisis. An enormous number of people have received extra support during that period, and the government has been making the money available to ensure that that happens. But it is only right that when there are court judgments, they are examined carefully.
36 withdrawn. Justin Mathers.
Thank you, Mr. Speaker. In common with many members, I'm having trouble getting timely responses to written questions from many government departments. I've got about 30 outstanding at the moment, some of which are more than 3 months old. One in particular, though, will be of interest to all members, which is in relation to preparations for Remembrance Sunday. All legions up and down the country beginning to think about what we can do to have a COVID-secure Remembrance Sunday. So can we have a statement, please, from the relevant minister as a matter of priority?
Mr. Speaker, I'm grateful to the honourable gentleman raising this point of timely ministerial responses. I will confess that I put in an envelope letters outstanding to one ministry from April, May, June and July in the hope that I might get a reply to them. If I don't get a reply in due course, I will tell you which ministry it is, but at the moment I think I will keep that quiet. Remembrance Sunday is one of the great important national days. I've absolutely heard what he said, and I will take it up with the relevant Secretary of State.
I'm sure my honourable friend will agree with me that our negotiating position has been strengthened as a result of the Internal Market Bill passing its second reading. That said, if the European Union continues to act in bad faith, the government must be prepared for an orderly departure with or without a deal. So can the Leader of the House confirm that the government has made all the necessary preparations if an agreement is not reached next month?
Mr. Speaker, my honourable friend is absolutely right in what he says about the UKIN bill strengthening our hand. We left with a deal in January, and planning for the end of the transition period is well underway, coordinated by the EXO Cabinet Committee, to make sure that we are ready to seize the great opportunities of being outside the single market and the customs union. With the Internal Market Bill going through Parliament, I can assure my honourable friend the government will have full legal ability to maintain the sovereignty of our nation and the integrity of our internal market. We have launched a comprehensive communication campaign to make sure people and businesses know what they need to do to prepare for the end of the transition period, and that remains a central priority of the government and departments.
Let's head to Scotland with Peter Grant. Peter Grant.
Thank you, Mr. Speaker. Can I first of all correct the Leader of the House in his assertion, which he repeated again this morning, that those of us who are working from home are somehow not at work? That'll certainly be news to my wonderful constituency team, who dealt with a fourfold increase in casework this year without having to set foot in our office. The Leader says he wants Parliament to be a safe place for people to work. He must know that some members of parliament are making it a more dangerous place by deliberately flouting safe distancing requirements in the chamber, in the voting queues and elsewhere. What steps is he taking to make sure that all MPs set a good example by complying with health and safety requirements in the House and by being polite to members of staff whose job it is to help keep everybody safe?
Mr. Speaker, the Honourable Gentleman's very, very last point is of very, very fundamental importance. And Mr. Speaker, both you and I have made it clear to all the staff at this House, and particularly to the doorkeepers and the security people, that they are allowed to ask members, remind members, and all other people on the estate of the need to maintain social distancing. And it would be quite wrong for any member to be high-handed when asked to remember the requirements of social distancing. I think one shouldn't be too critical, because inevitably, human nature being what it is, things will not always be perfect. But the work that has been done to make this a COVID-secure workplace is terrific. There are markings on the floor, things are spaced out, the seats in the chamber have been limited to ensure we are COVID-safe. And perhaps I should say to the Honourable Gentleman, he might like to come down and see how well it's working.
Fiona Bruce.
Does the leader share concerns about the safety of women following accounts of serious medical complications after some women have taken abortion pills at home, as is temporarily allowed during this pandemic? And shouldn't we therefore be looking to revert back as soon as possible to confidential in-person consultations being available for all women before such serious procedures are undertaken?
Leader of the House.
Mr. Speaker, my honourable friend is absolutely right to raise this deeply troubling issue, and it is important that safeguards that used to be in place are put back in place as soon as possible. I think of course, anything to do with abortion is not a matter where the government has a policy. So it is a matter for one's own private conscience. But the honourable lady knows that her conscience and my conscience align on this matter.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I'm suspending the House for 3 minutes. Order! Are you ready? Get yourself online.
You got it.
You ready? John?
Yes.
Order. I call the Secretary of State for Health, Matt Hancock.
Thank you very much, Mr. Speaker. And with permission, I'd like to make a statement on coronavirus and about our plans to put us in the strongest possible position for this winter. Like many other countries around the world, we're continuing to see a concerning rise in cases, with 3,991 new cases recorded yesterday. And this week, the number of patients in mechanical ventilator beds has risen above 100 for the first time since July. The battle against coronavirus is not over. And while we strain every sinew to spring free of its clutches, with winter on the horizon, we must prepare, bolster our defences, and come together once again against this common foe. One of our vital lines of defence has been taking targeted action at a local level. We've seen local action work well in some parts of the country, and now we must take further action. Mr. Speaker, we've seen concerning rates of infection in parts of the northeast. Sunderland, for example, now has an incidence rate of 103 positive cases per 100,000 population. And in South Tyneside, Gateshead and Newcastle, the figures are all above 70. As a result, local authorities wrote to me earlier this week asking for tighter restrictions, and we've taken swift action to put them in place. From tomorrow, in Northumberland, North Tyneside, South Tyneside, Newcastle upon Tyne, Gateshead, Sunderland and County Durham, residents should not socialise with other people outside their own households or support bubble. Hospitality for food and drink will be restricted to table service only, and late night restrictions of operating hours will be introduced, so leisure and entertainment venues must close between 10 p.m. and 5 a.m. Mr. Speaker, I know, the whole House knows, that these decisions have a real impact on families, on businesses and on local communities. And I can tell everyone affected that we do not take these decisions lightly. We agree with the local councils that we must follow the data and act, and the data says that we must act now, so we can control the virus and keep people safe. And I know that the people of the North East will come together to defeat this virus, as defeat it we must. Mr. Speaker, we're working to bolster our health and care system too. Winter is always a stretching time for health and for care, but this winter presents particular challenges. People will be spending more time indoors than in the summer, where we know that the virus is more likely to spread. And we know that we will need to deal with coronavirus along with the usual pressures that season will bring. So today I want to set out our plans to support the NHS and social care this winter. Turning first to the NHS, I can tell the House that we've allocated a further £2.7 billion to the NHS to support it during winter months. This funding, in addition to the extra funding for PPE and testing, will help the NHS with the vital task of operating safely in a world in which COVID is still at large. And the task, which is critical, of working through the backlog of elective work that was inevitably caused by the first peak. Mr. Speaker, our emergency departments are on the front line of the fight for life in the NHS. Today I'm delighted to announce a series of measures to support our urgent and emergency care system this winter and beyond. And I want to thank and pay tribute to Catherine Henderson, the President of the Royal College of Emergency Care, with whom I've worked closely to develop these proposals. I want to thank her, and through her, all of those who work in emergency care for their service in the face of adversity. I saw this again this morning at St Thomas's Hospital A&E, and I know that all of us support the work of those who work in our emergency care facilities right across the country. And I very much hope that yours, Mr. Speaker, will be opening soon in Chorley. Mr. Speaker, we will make our emergency departments bigger. Many are simply too small. This was true even before the pandemic, but it's even more acute now. So we're investing to expand capacity in urgent and emergency care, so hospitals have the space to continue treating patients safely in the coming months. In August, we confirmed £300 million for emergency upgrades across 117 trusts, and I can today go further and announce £150 million to expand 25 more emergency departments, including some of the most constrained in the country, like Worcester and the Royal Shrewsbury. This extra funding will put us in the strongest possible position for this winter and boost the crucial work to accelerate non-COVID care. Mr. Speaker, it's not just about the space, but about the service. So we're working to get patients the right care in the right place by expanding the role of NHS 111. During the peak of this pandemic, we saw millions of people using NHS 111 on the phone or online to get the best possible advice on coronavirus, helping them to stay safe and, where possible, stay out of hospital, where they could have unknowingly spread the virus. It's crucial that ahead of winter, we use this window of opportunity to seek out what worked and build on it so we provide a better service for patients and protect the NHS. Of course, no one will ever be turned away from our emergency departments in the most serious of cases. However, we've worked with the Royal Colleges, with the NHS and others to develop a better, quicker and more clinically appropriate service for patients by using NHS 111 first. How it works is this. We'll invest £24 million to increase call handling capacity and to make sure that there are more clinicians on hand to provide expert advice and guidance. And we'll build on our trials to make NHS 111 a gateway to the emergency care system, providing a first port of call for patients. So in future, rather than having to queue in an emergency ward, we're testing that people should call NHS 111 first to book an appointment with whoever can give them the most appropriate care. Whether it's a GP, a specialist consultant, a pharmacist, a nurse, or community services. And of course, if they need to go to the emergency department, then NHS 111 will be able to book them into an appropriate time slot. We want to see this approach lead to shorter waiting times and better availability of appointments for patients. We'll consult on how its performance is best measured, and with successful pilots, we'll roll out NHS 111 first to all trusts from December. Finally, Mr. Speaker, I wanted briefly to update the House on our work to protect care homes. One of the worst things that we know about this virus is that it reserves its greatest impact for those who are physically weakest, especially the elderly. And so we must do everything in our power to protect residents in social care. In May, we introduced the Adult Social Care Infection Control Fund, which has helped adult social care providers to reduce the rate of transmission. This was used to fund important measures like improving infection prevention and paying staff to self-isolate. And I can now inform the House that we will extend this fund for 6 months and provide over £540 million of extra funding for providers. This brings our total funding for infection control measures in social care to over £1 billion, and we'll also shortly be bringing forward our adult social care winter plan, because we'll do whatever is humanly possible to protect our care homes from this virus so that they're a place of sanctuary this winter. Mr. Speaker, we'll soon be facing winter in this fight, and whether it's on our NHS emergency care wards or in our care homes, we'll strain every sinew to give them what they need so they're well equipped for this pandemic and indeed for the years ahead. And I commend this statement to the House.
Shadow Secretary of State Jonathan Ashworth to reply.
Mr. Speaker, and thank you to the Secretary of State for advance sight of his remarks. The capital investment for 25 A&Es will be welcome. And on the piloting of the 111 to triage ahead of A&E, given inequalities in accessing healthcare for the poorest and disadvantaged, how will he ensure this doesn't worsen health inequalities? And if this leads to greater demands on primary care, will GPs be given extra resources as a consequence? The NHS is facing a likely second spike, winter pressures and a monumental backlog in non-COVID care. The Chancellor promised to give the NHS, quote, whatever it needs. Does that promise still stand? And will the NHS get the funding it now needs to tackle the growing backlog in non-COVID care? On social care, can he guarantee care homes won't face the same shortages of PPE that they faced at the start of the pandemic? And does he accept that restrictions on family visits causes huge harm to residents? Does he rule out reimposing nationwide restrictions on family visits? On testing, Secretary of State said little about testing this afternoon, Mr. Speaker. Back in May, he stood at the dispatch box and told this House that everyone aged 5 and over with symptoms is now eligible for a test. Anyone with a continuous cough, a high temperature, a loss of change in their sense of smell can book a test. We have, in his words, now got testing for all. Yet 4 months later, for the British people, it has become not so much test and trace, more like trace a test. At just the point when many fear we're on the cusp of a second deadly spike, the Prime Minister admits we don't have enough capacity. And rather than fixing testing, the Secretary of State is restricting testing. In the exchanges on Tuesday, 33 members from across the House raised issues around testing in their constituencies. He responded with the local figures. It was a very good debating trick. Well done to the Special Advisor for producing the briefing. But it will be no comfort to our constituents who are advised to travel hundreds of miles for a test when ill. It's no comfort to parents with a poorly child, themselves sick with worry, unable to get a test. It's no comfort to those who were turned away from walk-in centres and now are presenting at A&E asking for a test. It's no comfort to the 25,000 teaching staff who are not in schools teaching our children because they can't get a test. What people want to know is when this Secretary of State will fix testing and deliver on his promise that testing is available to everyone. Now, the Minister of State on the media this morning said there will be priorities for testing. So can he outline what his rationing plans are? Care England says weekly testing of all care home staff is still not happening. Will care home staff get testing under his imminent rationing plan? And what about people living in areas of restrictions, including the North East? Will the North East get all the mobile testing sites that they request? And what is happening in university towns with thousands of students set to come to universities across the country in the next 2 weeks? Will there be extra testing in those areas? And in July, he pledged 150,000 asymptomatic tests per day by September. Has that commitment now been abandoned? But, Mr. Speaker, we shouldn't be in this mess. We warned him that without fixing testing and isolation, that infections will rise. And rather than increasing capacity over summer, Pillar 1 and Pillar 2 lab capacity remained broadly flat. He's now setting up more commercial lighthouse labs, but why not invest in the 44 NHS labs instead? And there are still problems in these commercial labs, aren't there? There's a huge number of voided tests across the commercial labs. Randox had 35,000 voided tests across August. And today's stats show test turnaround times, again for testing in these labs, getting longer. Serco is still failing to trace 80% of contacts. At what point will he step in and strip poor-performing outsourcing firms of their lucrative public sector contracts? Now, Mr. Speaker, when testing breaks down, case finding breaks down, isolation breaks down, and we lose control of this virus. The British people made great sacrifices. They missed family celebrations. They couldn't say their final goodbyes to loved one at funerals. But the British people honoured their side of the bargain. In return, the government was supposed to deliver effective testing and tracing. The government failed. And now we have vast swathes of the country under restrictions. Where do we go next? The Prime Minister yesterday said a second lockdown would be disastrous. Obviously, we all want to avoid a second lockdown. But the British public deserves some clarity. Is he completely ruling out a second, short, national lockdown in all circumstances? Infections are rising at pace, but it's not clear what the actual strategy of the government now is. It's all very well talking about camel humps and moonshots We need a plan to fully suppress this virus. It's urgent that he fixes testing, fixes tracing, gives people isolation support to avoid further restrictions. Otherwise, we face a very bleak winter indeed.
Thank you very much, Mr. Speaker. Madam Deputy Speaker, to respond to the constructive questions that the Honourable Gentleman raised, I welcome his comments on the use of 111 First. The purpose of 111 First is indeed to improve access in terms of inequalities in the NHS by ensuring that people get the right treatment in the right place and easier access if they do need to go to an emergency department, because the emergency department will know that they're coming. It's commonplace now in almost every part of our life to let people know if you're coming. And if you're going to do something as important as visit an emergency department, it will help both the patients seeking treatment and the NHS to let them know that you're coming first. That's the principle behind 111 First, which of course sits alongside 999 that anybody should call in any serious incident. He asked about the need for extra funding for the NHS, both for winter and for testing. I've just announced £2.7 billion of extra funding for the NHS, and I thought that he might have done rather better to have welcomed it. He talked about tackling the backlog of cases that inevitably built up in the first peak. The good news is that we are making progress in tackling that backlog and reducing the backlog. Of course, there's an awful lot of work to do, and that is part of what this extra funding will go towards, alongside the funding to expand our emergency departments and the funding for PPE and, of course, the funding for testing that I mentioned in my statement. He asked about PPE for care homes. We have a huge plan to ensure that care homes can get PPE, and the details will be set out shortly in the social care winter plan. And he asked about family visits. Now, the challenge of visits to those living in care homes is, of course, an incredibly difficult one, because nobody wants to spread coronavirus. Yet, also, we need to make sure that those who live in care homes get the support that they need and that they deserve. He asks about testing, and of course there's a challenge in testing. The central point is that capacity, contrary to what he said, capacity is at record levels and has increased week on week. The challenge is that demand has gone up faster. And they can say on the other side, no, it's not, but they can't defy the facts. And the most important thing for everybody across the country to hear from all of their elected representatives, if they are interested in helping this country get through this pandemic, is that if you have symptoms, get a test. If you don't have symptoms, please do not come forward to get a test unless you're specifically asked. That is what colleagues on all sides of the House need to be repeating to their constituents, because I come to then the point of prioritisation, which he rightly raised. And he raised I like him, and he raised exactly the right point. And the right point is this: we choose to prioritise care home staff and care home residents. Over 100,000 tests a day of the 260,000 capacity are sent to care homes. We could solve other problems by not doing that, but we prioritise those who live in care homes because that's the right thing to do. He asked about areas where there's restrictions. We prioritise putting tests into areas of restrictions, like Leicester, where there were over 1,000 tests yesterday. And this is the core point. When something